Talk about this. You see patients every single week, and they're coming in and more asking, what do I do if I'm exposed? People aren't quite clear. There's some confusion. So let's help
There
folks
is
out.
a lot of confusion, so let's go back to the basics, because as we see these case numbers go up, people are dealing with this question more and more. So first of all, what is the CDC definition of a close contact? If you were within 6 feet of a known positive for a total of 15 minutes or more in a 24-hour period, you meet criteria for a close contact. If you've been caring for a COVID-19 patient in your home, if you've had direct physical contact, what does that mean? You hugged or kissed a person who tested positive for COVID-19, if you've shared eating or drinking utensils with this person, or unfortunately, if they sneezed, coughed, or transmitted other respiratory droplets on you. These are the criteria, CDC criteria, for defining a close contact.
And that's a 14-day self.
Right, so now let's go through just slowly and carefully what you do if you meet criteria. If you were within that person's, that list of criteria 48 hours before that person developed symptoms in that window, or 48 hours before that person sent off their test specimen, you then have to self-quarantine for 14 days. As of now, based on CDC recommendations and guidelines, you cannot test your way out of self-quarantine. Even if you test negative 14 days in a row, you still have to self-quarantine. That's the incubation period potential of this virus. We may see that change. People always say now, should they get a test? CDC is recommending if you're a close contact, you get tested. No formal guidelines on when to do that. I asked Dr. Anthony Fauci, and he said a good idea, day 3, 4, or 5, and then again on day 11, by which time 97% of people will have converted and test positive.
Wow. No, good reminders right now. Everybody's traveling for Thanksgiving, or a lot of people are, rather.
Thank you very much, Jen. All right, we're going to turn now to ABC's Kara Phillips in Washington, D.C., who have the latest headlines for us. Good afternoon, Kara.